What's up, everybody? My name is Seth Velez, and I want to welcome all of you to episode 2 of You've Got Cancer, Now What? So today, we're going to talk all about a place where you stay in a confined space for 24 hours, 7 days a week. You get a toilet, a bed, 3 hot meals, and limited exercise. Today, we're going to talk about staying in the hospital for inpatient chemo. Oh, I bet you thought I was talking about jail. Well, it's kind of the same, and I'll explain why. What is inpatient chemotherapy, you ask? That's simple. It's where you get your chemotherapy in a hospital under the supervision of nurses and doctors. You stay there for the entire duration of your treatment and for a few days or weeks after your treatment's finished so they can monitor the side effects. In my particular case, it wasn't a few days. It was a few weeks. You see, I was initially scheduled to go in for 7 weeks, but I had some serious complications, so they held me there an extra week. So I spent 8 weeks in the hospital. And let me tell you, it was not fun at all. Unfortunately, I had to go into inpatient chemo blind, not knowing what to expect. But guess what? You don't, because I'm going to tell you what to expect and how to deal with it. So the first thing to expect is to be bored, like out of your mind. Imagine being stuck in your bedroom all day long, but you do get to go out and exercise by walking around the hospital hallways. Yes, around the hospital hallways. Not outside, not in like a fitness center. The hallways of the hospital. There's literally nothing to do. Now, I went to Thomas Jefferson University, and they did have TVs where I could hook up like an Xbox or my laptop so I could watch movies and do things like that. But honestly, you can only watch so many movies. You can only play so many games. I wasn't really a big reader before I got cancer, but I found myself reading books. And even then, you can only read so many books. You will literally be bored out of your mind. Your only connection to the outside world is the people that come to visit you, social media outlets like Facebook, Instagram, and YouTube, and the news. You get to watch a lot of the news because one of the channels they probably have in your hospital room is the local news channel. So at a minimum, at least you're up to date with all current events. Another thing you should be ready for if you're doing an extended stay in the hospital is not getting any sleep. And it's not just because the beds are wildly uncomfortable, but the chemo treatments you're getting require vitals taken every 4, 6, or 8 hours, depending on the kind of chemo or transplant or whatever you're doing. So imagine you go to sleep. You're resting. It's great. And next thing you know, you're getting woken up because your blood pressure has to be taken. Yes, it's annoying. You know what's more annoying? You finally get back to sleep, and the doctors that come in at 6:30 in the morning want to make you their first patient on their rounds, and they're knocking at the door at 6:30 a.m. They come in, and you deal with the doctors. So then you try and get some more sleep. But then the nurse has to take your vitals again. So you're up. And we're not even factoring in the blood work that has to be drawn at night sometimes, or the fact that the hospital is not exactly the easiest place to sleep in, or the street noises that are going on. So if you're doing inpatient chemo and you're staying there for a while, just be prepared. You're not going to sleep. They had me on Ambien to go to sleep, and I still couldn't sleep. So just get ready to be a complete insomniac. It's going to happen. The next thing you're going to have to deal with is crappy food. Hospital food sucks. There's no other way to slice it. I have yet to be in a hospital or talk to somebody who's been in a hospital that said the food was great. It's not. It's crappy. It's horrible. Especially when they put you on like special diets that are pretty much like eating cardboard and water. It's terrible. If you have people coming to visit you, have them bring snacks. What I was able to do at Jefferson was actually bring my own little fridge and have my own snacks. So my family brought me Gatorades and cookies and chips and all my favorite things. That way when I got a little hungry, I could snack on something that wasn't crappy hospital food. Because hospitals have snacks too, but guess what? They also suck pretty bad. And you're not going to want to eat those either. So if you can, have your family and friends bring you something that you enjoy eating, and then be prepared to change what you enjoy eating, because once they give you chemo, that might all get thrown out the window because you might not like what you liked in the first place. It happens. Next tip is pack comfy clothes. Comfy clothes. We're not trying to show out at the hospital. We're not channeling our inner Beyonce while getting chemo, okay? Be comfortable. Comfy slippers, flip-flops, pajamas, whatever is comfy to you, wear comfy clothes because you're in a bed all day, except for the 10 minutes every 2 hours you go out and walk the hallways. Wear comfy clothes, be comfortable. You're going to be laying down for a while. The easiest thing to do is be comfortable, be comfortable, be comfortable. I know I've touched on a lot of negatives, but there are some positives to doing inpatient chemotherapy. The first thing that comes to mind when I say positives about being in the hospital is nurses. Nurses, nurses, nurses. Nurses are an invaluable asset to you while you are in the hospital. Don't get me wrong, doctors know their stuff. They're the ones working on your treatment and figuring out how to get you into remission. However, doctors aren't the best when it comes to the chemo side effects. You know why? Because they're not there to witness it. They're not walking into your room every hour and a half, hour and 15 minutes to make sure you're okay and seeing how you're doing. They're not there watching you suffer. But you know who is? The nurses. And you know who's really good at advocating for you to get the best treatment you can possibly get to remain comfortable while you're going through chemo in a hospital? Nurses. Nurses have seen it all before. They have seen patients at their best, they have seen patients at their worst, and they are willing to fight for you to get the right medications that you need to maintain a certain level of comfort. Chemotherapy sucks. You're gonna be sick, you're gonna feel crappy, but there are things to help you. And the best people to go to get that help are nurses. Now granted, nurses need to have the doctor sign off on medications, so they can't just like give you stuff, but they know what works. They've experienced it, they've seen it. So if you have problems or you have trouble in a hospital, talk to your nurse. All the ones that I've personally had to work with while I was going through chemo in a hospital were fantastic. They understood where I was coming from and they genuinely wanted to help. And I feel like if you're an oncology nurse, that's your attitude. I don't think there's a bad oncology nurse. So if you're dealing with this in a hospital, talk to your nurses. If you're not feeling right, talk to your nurses. If you think you need a medication for anything, talk to your nurses. I promise you, they're there to help you and they will. They're the best part about doing inpatient chemotherapy at a hospital. The next positive about doing inpatient chemotherapy is you're in the hospital with other cancer patients. Now granted, not every patient is going to want to talk to you or be your friend. Understand that. But I know at Jefferson University, they introduced me to a guy that had a similar type of cancer to me. He had acute lymphoblastic leukemia. I had subcutaneous B-cell lymphoblastic lymphoma. Not exactly the same, but our treatments were. That's how they treated my cancer, was by doing an acute lymphoblastic leukemia treatment plan. So I was introduced to this guy who was already on his second round of inpatient chemotherapy, and I got to talking, and he gave me a lot of these helpful hints. While you're there, ask a nurse, remember how I told you to ask nurses questions? If there's anybody there with a similar type of cancer. If they say yes, ask them if they can approach them and see if they're willing to talk to you about it. If they're willing, then talk. That's somebody to vent to. Remember in episode 1, I told you need to vent? That's literally somebody else experiencing the same thing you're experiencing that you can talk to. They get it. If you get that opportunity and you can do it, do it. It is something that will help you tremendously. Trust me. My next point that I want to hit is visitors. Okay, the hospital can be a lonely place. Trust me when I tell you. And when you first get admitted, you might want people to come visit you all the time because you're bored out of your mind. So you need somebody to talk to. You need new faces. If you have the same people coming, it can kind of get boring. Not that I'm saying that people that are consistently there are bad. They're just boring. You know, you can only talk to the same person every day for so long, right? That's why we have friends and we go out and we do things. So if you can get visitors, cool. But keep in mind, if you're not feeling good, you don't need visitors. Do not, and I repeat, do not feel bad about telling somebody that you don't feel well and you don't want visitors. There was a point about 3 weeks in where the chemo started kicking in. I felt like complete dog crap and I had to tell people, please do not come today. Do not feel bad about turning somebody away. But of course, there are always those people that won't have the courtesy to hit you up, which is fine. They have the best intentions. They want to come see you. That's great. Tell your nurses that you do not want visitors. They will literally make arrangements with the front desk and tell them to turn people away if they come to visit you. I know that sounds, especially if you live far away like I did. I was an hour away from my hometown. But the truth is, if you're not up to visitors, don't force yourself. If you're feeling tired, relax. Let your body heal. Chemotherapy is literally killing you. Do not feel like you owe it to anyone to see them. You don't. You owe it to yourself to feel better. And if you need to rest to feel better, then I suggest you lay down, cut the visitors, tell people to leave you alone, and rest. Now, being in a hospital for an extended period of time gives you a chance to think. So remember in episode 1 when I told you to get over it and start thinking about your treatment? You did that. Great. Now you're in the hospital. Now you've got nothing else to think about. You're gonna feel down, you're gonna feel sad. Just remember that you're doing this for a reason. You're doing this to live. Cancer is trying to kill you. What you're doing is so you can live the rest of your life, spend time with your family, and do the things that you want to do. So although this 1, 2, 3, 4, 5, 8, 10 week stay may feel like an eternity and you hate every second of it and you don't want to be there and you can't understand why, just understand you're doing it so you can live. People want you to live. People want you here, okay? So this stay may suck. It feels like jail because it does, except the only difference is people in jail get to go outside. But at the end of the day, this is going to make you better. And that is the point of all the struggles of fighting cancer, is to get better, is to not let the disease win. So don't let it take you over while you're in the hospital. Maintain that positive attitude, maintain that fighting spirit, and remember, you are here to live, not let this consume you. I know I didn't cover like the side effects of chemotherapy in this video, and that's because I'm saving that for a whole nother episode. There's a ton of things I want to talk about and a ton of tips that I want to give to help you get through chemo. So bear with me. Next episode, I promise, we'll cover all of that. But for right now, if you enjoyed this episode, if you found anything useful, if you think somebody that you know will find something useful in this, please hit the subscribe button, hit the like button. If you're on a social media platform, please feel free to share this video and the rest of the series. My goal here is to help as many people as I can, and you guys can help me do that. Thank you for your time. If you want to keep up with updates for You've Got Cancer Now What, check me out on Instagram at DJSethV. I'll be posting all my updates for every video on there. Remember, this is a weekly series, so check back every week for new episodes. And if you're out there fighting the battle, keep up the good fight.